Hey everyone, welcome back to another virtual shadowing session. Today we have Dr. Wright. She's amazing, an amazing dentist, amazing person. If you've seen any of her Instagram lives, you know she's really thorough and dedicated to helping pre-dental students. So I'm so excited for this session. And whenever you're ready, Dr. Wright, you can start.
Thank you so much. First, I want to say thank you guys so much for having me to the Fresh Dental Shadowing team. I know it was a bunch trying to get this presentation, but I'm here. I'm a very busy woman, and just like you said, I really love helping dental students, pre-dental students, anybody that I can just pass my wisdom and my knowledge on to, just to kind of further your education, further your experience. I'm open to doing that. In fact, as soon as I get off of here, I have my group mentorship program. We have our meeting today right after. So I'm super excited to jump into that. We'll be talking about some of the same things. So I'll go ahead and get started. That is me. I'm Dr. Arnell Wright. I attended the University of Florida College of Dentistry. Let me just back up real quick. What's going to be discussed today is my background, my why. Why did I enter into dental school, into dentistry to begin with? My journey, which was very zigzag. It was kind of all over the place just because I had to really figure this whole thing out by myself, kind of in the dark. And I don't want you guys to do that, which is why I'm so dedicated to sharing my story and just kind of answering questions, sharing with students, just because it's a hard process in and of itself. And we don't need to make it hard just by not knowing certain things, if that makes sense. I'll talk about a typical day in practice with me, some dental procedures, how I set up the operatories or how I like for them to be set up by my assistants. I'll talk about my treatment planning phases, diagnosing and presenting treatment. I'll show you a case at the end. And I'll talk to you guys about what I'm doing now. So I attended the University of Florida College of Dentistry. I got my bachelor's, my master's, and my doctor of dental medicine degree all from UF. So I'm a triple grader. I love UF. That is my home. So I'm a big time Gator fan, as you guys can see. And I graduated in the class of 2017. In fact, this photo in the bottom right-hand corner, that is our graduation photo from our commencement ceremony. It was a really, really good day. And it was, of course, pre-COVID, so we were all smiling super big. So some of my deciding factors for going to the University of Florida, and these are things that I want you guys to think of too, is for one, it was my state school. So I live in Florida, and at the time, I think only Florida and Nova were the two schools in Florida at the time that I was applying. LECOM had not yet become a thing. So that tuition and those fees, it was really, really important for me to keep those numbers really, really low because it's already high enough going into a doctoral degree program, whether it's dental school, medical school, pharmacy school, whatever it is, the fees and the tuition is very, very expensive. So the fact that it was a state school is really the thing that kind of tied me to Florida, and it was close to home and close to my family. Going into a rigorous program such as dental school, dentistry, medicine, like I said, whatever it is, you really want to have support. I was already familiar with the University of Florida because I got my bachelor's degree there, my master's degree. I just stayed there. Like I love the city. I love the town. It was just like a second home, or it became a second home for me. And the prestigious academic reputation, like who wants to pass that up? Like, people say like, or one of our things with the University of Florida is we say like the Gator Nation is everywhere. And it truly is everywhere. Like everybody knows about the University of Florida. I mean, patients, they love to, talk about football. They love to talk about, oh, you're very well trained and this and that. And so that was one of the things that really tied me to going into that dental school. And then their mission, just being centered around like giving back, community service, servicing low income communities, which is basically my background. That's basically where I came from. Some scholarships and awards that I received, just to name a few. Dental Trade Alliance Foundation, I was a scholar for that. It was a $5,000 scholarship. I got that scholarship my junior year of dental school. It was amazing. Daryl Hawkins Memorial Scholarship through the Student National Dental Association at the national level. I applied for and received that scholarship. And then also in my junior year, I got the UFCD Student Leadership Award, which was another award that was associated with the International College of Dentists, just being a student leader at the institution. So that's just to name a few of my awards. Okay, oopsie. Oh wait, hold on, we'll go back. Okay, perfect. All right, so my experience in dental school, it was amazing. Man, those are like, I know we say that like bachelor's degree, your undergrad is like the best time that you're gonna have in dental school, which it is. For me, dental school was amazing because I got to meet my future colleagues, people that I'm still in contact with to this day, 4 years out of dental school, people that we're on a group chat with. We bounce ideas off of each other. We talk about treatment. We say, hey, what was this? What would you do in this case? Like, am I in the right direction or am I completely off the wall here? And I mean, there's pros and cons to like getting people's ideas on dentistry just because every dentist has a completely different frame of reference and a completely different approach, like whether you're conservative, whether you're aggressive, whether you're right down in the middle with your treatment. But we learned to be very, very conservative in our dentistry. And so it was amazing. I was a part of the Student National Dental Association. I was able to attend conferences. I was an ambassador for the admissions team. I went to mission trips. I went to two mission trips, one in Guatemala City, Guatemala, and then one in St. Elizabeth, Jamaica. Those were amazing experiences. And as we go on with the presentation, I'll talk a little bit more about the importance that I feel or the value that I got from going on a mission trip. I was a leader in Student National Dental Association at the local level and at the national level. And I was a tutor while I was in dental school. So it was really good for me to give back and just help students like as they learn how to be a dentist once they enter into the student clinics and as they're taking their didactic courses. So those are some of the amazing things that I experienced in dental school. Okay, so specialty. I'm not a specialist. I am a general dentist, and for me, I almost did specialize. I kind of want to skip down to that third bullet. I wanted to go into pedo, but in my senior year, my husband and I we got pregnant actually, and I finished my senior year big and pregnant, had my baby. I was taking boards, doing all these things, so I had to juggle, and then I had to just decide that like, man, this is probably not the best time for me because I'm just becoming a mom. So I was gonna actually go into pedo. I loved it so much. And then once we had the baby and I started practicing shortly after, I realized how much I loved general dentistry and how much I wanted to steward being a general dentist before just jumping into something else, just like a one, like doing one thing forever, excuse me. So what I mean by that is basically now that I've been a general dentist, like I still may specialize. I don't even know if it will be in pedo, but I do want to narrow my focus now that I've had the experience of doing a little bit of everything, if that makes sense. So for me, I think it was a good it was a good thing that happened to kind of slow me down because I wouldn't have gotten to know what I love, what I don't like so much, what I would want to do more of every single day, what I enjoyed, what gave me sparks, what I love talking about to patients every single day. So the thing about general dentistry is it allows you to do a little bit of everything. And the things that you don't feel comfortable doing, you can go ahead and refer those out to a specialist. The thing about referring out to a specialist is you want to make sure that you have connections with these people prior to just sending them a patient because they may have a different approach or a different idea about where the treatment should go, about how the treatment is to be rendered when they should intervene versus when you come back into the picture. So it's really good to have these relationships built with these people, like the specialists in your local cities before you start to specialize, before you start to refer to them. Now, the caveat to that is when you come out of dental school, and I know you guys probably are on here just trying to figure out how to get into dental school, but it's really good for you to be thinking about this just, while you're ahead. Um, the caveat is when you finish dental school and you begin working in a practice, if it's not your own practice that you're starting up or that you're doing a takeover and practice acquisition, more than likely the practice is going to have a specialty lineup of specialists that they already refer to. And so you may just kind of slide in there. But I would encourage for you to take the time to meet them. And the specialists, they want to meet you because they want you to send them referrals. They basically produce dentistry on a referral basis. So it's going to be very like smiled upon for you to reach out and to say, hi, I'm a new general dentist here. And then more than likely they'll have dinner with you, do something like that. You can exchange how you approach certain cases, what cases they want you to send at what point in the treatment sequence, et cetera, like that. So I just wanted to add that little tidbit in there, that before you just start sending patients to certain specialists, you want to make sure that you're just on the same page as far as the treatment goes, if that makes sense. Oh, did I go back? Okay. All right. So I mentioned mission trips, and this is a tip that I want to share with you guys, that I believe mission trips are one of the best ways to learn to be a clinician. What do I mean by that? So, like I told you guys, I went on 2 mission trips when I was in dental school. I don't even know how I had the time to do this, but it was an amazing thing. I went to Jamaica and Guatemala, and while I was on those mission trips, I think that's where my clinical light bulb began to come on. Now, I had already been in the student clinics for, I believe, maybe 6 months to a year, like a school year. And even though you're seeing patients, the thing about it is that you're only seeing one patient in the morning and one patient in the afternoon. So you're pretty much only able to go through an entire treatment plan, go through an entire sequence of thinking on one patient in the morning and one patient in the afternoon. And you're slowed down so much that sometimes all of the connections or the dots aren't being connected at one time. It may be like over a long period of time before you really learn a procedure from start to finish, because you have to get a start check, then you have to get a prep check, and then you have to get a restoration check, and then you have to have the faculty check your occlusion and this and that. So there's so many steps in it that you don't get to kind of go from start to finish. Whereas on a mission trip, it's not that you're just released in the wild, but you have dentists and you have upperclassmen, you have people that have been doing this for so long that may introduce new instruments to you. Whereas when you're at the school, you only have like whatever your cassette is, whatever you've been introduced to in your first and second year, that's all you may even know. And so you may feel restricted and confined to only doing and using those instruments. Whereas on a mission trip, there are instruments from all over, depending on where the doctors come who attend the mission trip. Like when I was in the Jamaica one, we had a doctor who came from California, one who was in Florida, one who was from another city, I can't remember, but they all had, and each one of them had like, oh, these are the instruments that I like to use when I'm extracting teeth or when I'm doing endo. These are the hand pieces that I want to use, you know? And so had I not been on that trip, I wouldn't have even known. Like, for instance, I'll give you an example, like a luxator, which you guys don't need to know this right now, but you all that are in dental school, you'll know exactly what I'm talking about, versus an elevator. So like in dental school, we were not introduced to the luxators unless you had a special interest in surgery, if that makes sense. So if you were just getting your requirements done, you had whatever came in that instrument pack. And it's for good reason. Like, you don't need to be bombarded with instruments if you can't get the basics down. But what I believe was amazing for me on this mission trip was the fact that I got to be introduced, and I was pretty much encouraged, not forced, I was encouraged to use different instruments to see what I liked, to see what felt good in my hands, to see what I didn't like, to see what I needed, how I needed to improve my hand skills when using that particular instrument. If I was, and especially I was able to compare and contrast whatever my skill set was when I'm in the academic setting as opposed to the mission trip setting. And I was able to expand and just better that, if that makes sense. I know I kind of beat a dead horse there, but I really want to encourage, if you're able, and I don't know, you know, it's COVID, we're in the middle of that, so you have to navigate that with your institutions. But if you're ever able to attend a mission trip, I say go. It is the best 7-8 days that you're gonna get that clinical exposure. I learned to anesthetize very, very well. I learned different anesthetic sequences based off of different doctors who had been practicing. And they say, oh, well, no, I'll use this anesthetic and then I'll back it up with this and then I'll do this, you know? And so, whereas in school, it's like you just start with your lidocaine, you know, or your septocaine, and that, like, those are the only two that you learn. But I was able to just learn different tips and really just take those things into practice with me, so that I can be even more of a well-rounded clinician, if that makes sense. Okay. All right, so practice. Where am I located? Okay, so I currently am employed by a DSO, which is a dental service organization that is corporate dentistry. And I'm going to spend a little bit of time here because one of the question was like about the pros and the cons, excuse me, of corporate. And it's a big discussion. Like in dental school, you know, it's kind of like don't work for corporate, you know, but we'll get there. So I'm in Orlando, Florida. Again, I stayed in Florida. This is where my family is. They're not directly in Orlando, but it's like a right smack dab in the middle. So we just have to travel like an hour or two to get to our families. And the deciding factors on my job was that I really am invested in learning the business of the field because in dental school, that's something that we're not afforded to learn in depth. We get to learn how to be an amazing doctor, and we get to put together how to diagnose and how to treat. But that business and that managerial, the practice management side of the field, we only get exposed to, or at the University of Florida, I should say, I'll speak only for our school, is that we only got exposed to it for maybe like a semester. And that's not long enough, in my opinion, especially if I want to open a business and run a thriving practice. Now, it can be done because the way around that is to have a mentor in a private setting who's really going to take you under their wing, and they're going to show you the ropes, and not only the clinical ropes, but it's somebody like who may be on their way out. And when I say on their way out, I mean ready to retire, hanging up the handpiece, wanting to pass the business and the practice over to a more fresh, you know, new graduate. Not necessarily like your first year out, but maybe after your second or third year. Okay. And for my job, I really love the fact that they had the clinical autonomy. And the way that I was able to uncover this was I went to multiple practices before I signed the contract. I asked questions about, are you being pushed to do a crown or over a filling, or is there any manager who's like infiltrating and changing your treatment plans? Because that's all, excuse me, that we had heard while being in dental school, that, oh, in the corporate offices, the managers, they will change your treatment plans, or they'll make you do crowns, or they'll make you do like dentistry that's subpar. And so I wanted to ask those questions before joining and signing the contract. I even went to the office, I met the team, and I realized that they were a group of a seasoned dental team, that they had, you know, kind of assimilated over the years. And the doctor who was there, he was older, he was retiring. And so they needed somebody who could kind of come in and take his place. So as far as the question goes, private or corporate, what are the pros and cons? I would say both. This is how I operate. Do your research. Like I tell all my mentees all the time, I'm like, listen, you can listen to me to a degree, but also you can trust, but then also verify. So do your own research and don't leave it up to someone to make the decisions for you or to lead you in a direction that they went. And it's not that they're going to lead you astray, but you do your own self a disservice by not checking and not knowing for your own self. So I'll break down some pros and cons of corporate, and then I'll talk about private. But I can only speak, you know, in depth about corporate because I've only worked for corporate. I've had private opportunities, and they just weren't what I was looking for at that time. So I'm not completely opposed to it, but I don't have as much information, and I don't like to lead people astray either. So as far as corporate goes, some of the pros are. You get that clinical autonomy. You're going to learn the business of the field. You will learn to have be speedy with your treatment delivery, because if the office is busy, all corporate offices are not busy. There's something called a de novo practice, and a de novo practice means brand spanking new, like they're building it from the ground up. No doctor has ever stepped foot into that practice. So that is an option. Okay. Now, if the practice is busy, you will be able to increase your speed, which in dental school, your speed is the thing that you don't have coming out of dental school, because you're only seeing one patient in the morning and one patient in the afternoon. So it's good for those reasons. You make decent money, you're able to pay off your loans. They have like the benefits such as the insurance, the 401k. Some companies do the matching. Some companies provide bonuses if you hit certain metrics. But then again, you have to be invested in knowing the business side if you want to kind of understand how you're compensated, which I think you should know, because when it's your money, you want to know, like, your money is also tied to your license to practice. So you need to know how you're being compensated and what you're compensated for, and how that's communicated to an insurance company. That's a completely different topic that we can discuss at another time. But some of the cons, which is what I've just mentioned, are, managers changing your treatment plans, um, you being pushed to do certain procedures that you don't necessarily agree with. A big one in corporate dentistry is being highly encouraged to keep everything in house and to not refer out. Um, I don't have this interaction, but I have a bunch of friends who also work for corporate offices. But I have been asked, I will say, I've been asked over the time that I've been working, like, "Hey, doc, oh, why did you refer that endo out? Or, you do endo so well, and da da da." And I get it. But the thing about it is if there's something that I don't feel comfortable with, and if I'm not gonna put the patient in the best scenario, then I don't feel that I should be the one performing the treatment. Because then again, there's conversations that have to be had if something goes wrong, then I'm going to be on the other end of those conversations, and I don't like to have those situations. So being encouraged to keep everything in house, it's not necessarily a bad thing if you're strong in whatever you're being encouraged to do to keep in house, if that makes sense. So, like, as long as your comfort level is up on those type of procedures, keep it in house. But at the end of the day, if you're not comfortable, there are specialists out there for a reason. The next question is, are there any important factors to look out for when applying to and accepting jobs? And the answer is yes, for sure. You want to know if you're a good fit. So the same way that a company is vetting you out, you want to vet them out as well. And what that basically means is you want to ask some very direct questions about the best fit, maybe even about the culture, not only of the practice, but of the company. So if you're going to work for a corporate office, you want to know what the culture of the company is. That'll give you an idea of what to expect when you show up on day one. Another thing is, if you're going into a private setting, you can ask what the culture of the practice is, because maybe that doctor might only have that one practice. They may have a second office that you'll be managing and taking over, once or twice a week. But you want to ask, what are those expectations? What do they expect for you to do as a doctor? How is the relationship going to be between you and the office manager? Because that's one of the cons for any practice setting, is sometimes the office managers are empowered to be more like the leader of the practice, as opposed to the dentist who has the license to have the whole establishment open, if that makes sense. So it's really, really important for you to know, like, what is that relationship going to look like? I would even encourage doing a working interview, maybe 1 or 2 days. And usually they do compensate you for a working interview, because they want to see how fast you are, how deliberate and quick with your decision making, meaning your treatment plans, your diagnosing, and your completion of treatments. How quickly are you? And then, if you are a good fit, if your personality meshes with what's already established in that group setting, if that makes sense. I also would encourage for you to meet the team. Take the time to see where and how you fit in. Talk to them about, how long have you been here? What's the turnover like? How is it working with Dr. So and so? What's his treatment planning like, or what's her treatment planning usually like? If can you pull up some X-rays and show me, like, what were past treatment plans like for within the past week? How do they diagnose perio? That's a big thing that doctors and hygienists typically butt heads about, is diagnosing perio. Perio is like the hardest thing, because it's like every person has like their own idea of, like, oh, well, it's a 4, so it definitely needs to be diagnosed as this, or like the pocket depth measurement is what I'm talking about. But then again, you want to know, what are those measurements? What are those boundaries? What is his or her idea of treatment? And if it's in alignment with with where you are right now, if you're a new grad, more than likely it may be a little more aggressive than what you're ready for. But if you're seasoned, you may say, oh, okay, I can see how that can work. You know what I mean? I hope that makes sense to you guys who are out there watching. I talked about that like a lot, but it matters to me so much because I want you guys to enter into the workplace like as prepared as you can be. And I'll go back to one other thing, excuse me. You should even try to get a mentor doctor if you can within the company. Like if there's someone who you can go and shadow. I did that before I even started. It was a part of my negotiation strategy with the contract. And another thing to look out for is to read your contract for sure. But part of my negotiation strategy was, I'm like, I am fresh out of school. Like, yes, I can handle this. And by the way, I was the only provider in my practice. I've only always worked by myself since graduating. And I have a leadership ability to myself. So I wasn't really too worried about that. But knowing just the business side, again, I didn't know that. And so I wanted to spend time with the doctor before I started in my own office. And I was afforded that opportunity. So that's another nugget for you guys, is to ask if you can have a mentor doctor, somebody to shadow, to watch how they run their operation in their practice. Okay. So a typical day in the practice with me, excuse me. So we have morning huddle at 8 a.m. every single day. I know some practices, they don't have morning huddle, but we have a morning huddle all the time because I want to review the schedule for the day. Like so many changes happen between Monday and Friday, or, from 8 a.m. to 5 p.m. in one working day, that I want to know what changes have happened, what's happening, what's on my schedule right now, what do I need to plan for, what should I try to avoid, et cetera, et cetera. So we review the schedule for the day. We check the cases. And what I mean by the cases is, are the people who are on the schedule to receive a crown, a denture, a partial, or a bridge, anything that has a lab involved, is that case here today? And if that case is not here, we need to get on the phones right away and we need to reappoint or reschedule that patient. So reappoint is just another way of saying we need to reschedule that patient. But usually we're able to catch those things because in huddle we do what went well from yesterday, and then we a review of what went well from today, a review of yesterday, and where can we improve for tomorrow. So that's kind of how we focus on our morning huddle. That's like the strategy. We look and see, are the cases for today, or have they been arrived? Are they arrived? Are they en route? Do we check the tracking? We go that far to check to see, like, all right, is it on the UPS truck? Is it out for delivery? Like we do that the day before. It's a little OCD, but for me, I'm really conscientious of patients' time, and I just don't like for patients to waste time because I know how valuable my time is. So I try to prepare as best as possible, even for materials. Like if we do not have like a certain impression material that I want for this particular case, we need to reschedule the patient. We need to make sure that we have everything that we need when we need it for the patient that's going to be in the chair that day. And there's another reason behind that. This is more along the business side of dentistry. Is when you don't check, when you're not very keen and into the details of your day, you end up losing money. So there's ways to make a decent living, but it's just in being detail oriented, just knowing what's in your practice, what you need to be in your practice, and where people should go and where people should not be based off of the materials or the cases or things that's not there. Because when they come in and you don't have the case, a patient who was a treatment that you could have been doing some type of treatment, a filling, a crown, or an extraction on, they could have been in that slot. But that patient who we weren't prepared for actually took that slot, and then it ended up being like a $0 visit or something like that. So, like, I know that's like aside from patient care, but it's a way for you to know, like, all right, you can keep your dollars flowing in your practice if you just pay attention to the details. Like you don't have to do anything extravagant. You don't have to push certain treatments, but if you just schedule appropriately and if everybody knows what's happening in the practice, you're going to do well financially. In the morning huddle, we also talk about where is a good place to put emergencies. I like to run a pretty tight schedule. So I like for my schedule to go as planned. And then if are any blocks or any margin, I like to say, okay, 11, I see that we have a blocking column, blah, blah, blah. We can put a patient for an emergency there. Or, oh, I see in column 3, we have a block at 10. That's a place for an emergency. So that's a way for us to control our schedule as opposed to the patient controlling our schedule, if that makes sense. That's another business tip. It's just like making sure that your office is always in control of the schedule more so than bending and then running out of time and running through lunch because we just wanted to squeeze someone in. And I understand squeezing them in for the purpose of an emergency, but what's more important than that is you don't want to run your staff down. You don't want your doctor to be tired. You don't want your staff to feel overworked, and they're not getting a lunch. They're constantly working, seeing patients. So it's all about balancing the day. And then we run through the recall exams from the hygiene side. The hygienist will tell me, hey, doctor, I need you in to see these patients, this patient at this time for a recall exam. And in those cases, we kind of do a flip flop. So on my side, I'll have my new patient column. I'll see the new patient adults first. And then by the time the x-rays are done, I'm done with my examination. My hygienist will be ready for me to go and do the recall in her chair. And then she'll swap to my chair to do the perio probing. So that way we're always capitalizing on and maximizing our time for the day. I don't know if that kind of makes sense, but my assistants and I, we ping pong really quickly. We're like, okay, well, doc, you have your exam at this time. Why don't we take the x-rays first? And then even if the hygienist needs to take x-rays, she'll take her x-rays, do her cleaning on the patient. And then by the time that she's ready to be finished and she needs me to do an exam, I'm actually ready for her to come in and do probing in my room. And so we do a little switcheroo. Another little tip. I wasn't prepared to share that, but it rolls off the tongue because this is just how I operate. So patient care begins at 8:30, and we like to do quality over quantity. This is another thing about corporate. So a lot of people ask me if I have to see a ton of patients, and I have some friends, they work at corporate and they see a ton of patients. But I'm going to be honest, I don't see that many patients in a day. I may see 18 to 20 patients, and we prefer to have a quality patient load as opposed. I know that's a little bit. That's not a lot at all. But I mean, that's on my side, and then I still have to do some hygiene checks or whatever. And the reason why I say we don't see very many patients, like I have friends who they see maybe like 50 patients in a day, and I'm just like, whoa, you have to be so tired, like dead. I'm not dead, which is probably why I'm able to do all the things that I do on Instagram and social media because I'm not bogged down with patient care. But I've also, even though I'm seeing a smaller amount of patients, I've gotten really, really good on my time being quick but accurate. So everybody talks about getting your speed up when you get out of dental school, but no one discusses the accuracy. You need to be accurate with your treatment plans as well and with the delivery of your treatment as well. Again, because once you start having the patient come back 4 and 5, 6 and 7 times, then now you've just lost whatever money you have made on that situation. So we want to work smarter, not harder, is a thing that we say in our practice. So quality over quantity. We make sure that we have everything together. We break for lunch at 1. It's a later lunch. I changed it to 12 at one point because I noticed that my assistants, they get a little hangry around 12 o'clock. And then they asked for it to go back to 1. So I was like, okay, I'm cool with that. And then we resume with patient care at 2, and we go from 2 to 5. I don't work on Saturdays yet. We thought about introducing it into my practice. And again, like it was just going to be something that I did on my own volition. Nobody forced me or told me I need to work on Saturdays. I was just going to open up like a one Saturday every other month, 8 to 12 type of thing. I don't know. So, and the thing that you want to know is in between that time, you have to do your notes. The instruments have to be sterilized. You have to open up packages, put things away. You have to do insurance verifications. Your supplies have to be organized, and then you have to turn over rooms. So it's a lot of moving pieces that are happening in a practice in a day. I hope this is good so far. Okay, so let's talk about, let me move this over here. Ooh, sorry. So let's talk about diagnostic information. I know some of your presentations, you may not go into this, or I don't know. I haven't been on one, but I want to talk about like the most information that you're going to get in order to diagnose a case. And I talked about this on one of my lives. I think maybe my most recent Wisdom Wednesday. But the thing that you guys need to know is that in order to diagnose a case completely and to do it accurately, you need to have a good, thorough examination. The way to do that, first, you have to have diagnostic x-rays. What diagnostic x-rays mean is that you can actually see. And if you see this image right here, it is crystal clear. I can pretty much see everything. I can see the jaws. I can see everything, the TMJ, the sinuses. I can see everything. It is a really nicely taken x-ray. All right. And then let's try to move this. I don't know if this is blocking your view, but there's something called a full mouth series. So I usually just take an FMX, which is a full mouth series, and I take a pano on my new patients. The full mouth series, it can range anywhere from 16 to 18 x-rays, and it's going to be a combination of bite wings and PAs or periapical x-rays. And the purpose of those bite wings is to look in between the teeth to see if there's any decay in between the teeth and to see if there's any horizontal or vertical bone loss. And then the purpose of those periapicals is basically to look at the apex or the apices of the tooth, the root of the tooth, to see if there's any infection or if you see right here any pathology at the root of the tooth. So we want to see both of those because we look at different things on different x-ray sets. And then with the panoramic, we don't use that to diagnose decay. I know that question comes up a lot, like, oh, well, you can see that there's decay on the pano. You can, but we want to confirm and be sure about it by looking at a bite wing. All right. But the purpose of the panel is to look at like the jaws, the sinuses, to make sure everything, there's no pathoses or pathology in the TMJs, just to make sure that everything is clear and good from like in the head and neck region, because we're the doctor of the head and neck. And then another thing that I don't have, oh, yes, I do. I have it on here, is intraoral photos. An intraoral photo is your best friend. Even if you snap it on your iPhone, if you don't have an intraoral camera, if you snap it on the patient's phone and ask them to email it to you, you have to discuss HIPAA and all of those things like that in your office to see how that works. But an intraoral photo goes a long way. And the reason why I take intraoral photos is not only for like proof, but sometimes a picture is just worth 1,000 words. Patients cannot relate to x-rays, but they can relate to a photo. They will know when they see something there that is potentially not supposed to be there. And so here I'm just showing like an oral cancer screening. I do a visual screening. Some places they want you to do what's called a light, like a Visilight, or there's another type of oral cancer light, but Visilight is the first one that comes to my mind. Oh, the Identify, that's one. And the thing about that is, what I've learned is that a visual inspection is more than enough. Like if you look at the tongue, look down the throat, palpate the tissues, intraorally and extraorally, making sure that everything is clear. There's no abnormalities, no swelling, no movement. That should be enough. But if you're trained on the Identify, then it's just an added feature. Like I have no issues with it. Okay, so I posted this on Instagram and I wanted to post it here because I want you guys to have a way of thinking through treatment decisions. And one of my friends, she told me one thing that I left off of, which was a bridge. And I'm so glad she did, because I'll go back and add it. But she told me this on Instagram. So, but I'll say it here with you guys. One way that I think in my mind, just all the time when I'm looking at teeth and I'm looking at the mouth, when patients come in, I'm thinking about restorability. So can this tooth be restored? When it comes down to restorability, I'm also thinking about the perio, so the foundation, the house, and the tooth is, I guess, the house, and then the gums is the foundation. It's the ground underneath. So I do think about that. So is the tissue restorable? Is the foundation, is it set? And then I just go through in my mind. I'm always thinking this when I'm treatment planning. If it's a yes, then I think about how can it be restored? And these are the ways that it can be restored: with the filling, a crown. Is it something like a bridge? Can that go in? Or is it an implant, or, whatever? And if the tooth is not restored, not restorable, then I don't even think about all of these other things. And the reason why I bring this up is because as new dentists, when you get out, again, I know you guys are trying to get into dental school, but when you get out of dental school, sometimes you may second guess yourself and you may say, oh, well, I can try to do the filling, or I can try to do, because patients will push you to that point where they're just like, no, I really just only want you to do this one thing. And it's just like, no, 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 no. So um I bring this up because I want you guys just to know that this is just a quick way of getting your mind. And of course, you want to fact check it, ask your faculty members, like, hey, what are your thoughts about this? And then they'll lead and guide you in the best way that's possible for you to make those good treatment planning decisions. But it's just a way for me to know, all right, if it's restorable, these are all the things that I'm automatically thinking of. And then the reason why I do this also is because I want my staff to kind of be an extension of me and to help me make these decisions, meaning like, okay, well, you already said it's non-restorable, so they should already be thinking like, well, if it's non-restorable, it can only be extracted. And then they'll begin to say, hey, doctor, you want to do a partial there, a bridge, whatever the treatment is. And then I'll just say, all right, okay, good. You're thinking with me. You're right ahead. They're anticipating what I'm going to do. You know what I mean? So I just wanted to bring that up. You guys can snap a picture, find it on Instagram, do whatever you want. But, it's there for you guys to kind of put it in your head, just put it in your mental Rolodex that, all right, when it comes down to making treatment decisions, this is a pseudo quick way of doing that. Okay. This is what I'm pretty sure you guys really want to see is like some cases. And I named this slide some cases that require special attention. So I see special needs patients all the time, and I see patients who they just can't be seen because no one takes their insurance, such as like a Medicaid or a Medicare plan, or even like an HMO. Those type of insurance plans, they're just not accepted very readily, and if they are, the fees are just astronomical. So even with the plan in place, the patient still can't sometimes afford the treatment, right? So I'll talk about two different cases. So right here on the side, I had a patient who came in. He had been in a car accident, and then he had suffered just so many injuries. It caused him to be wheelchair bound. He had some broken teeth, and he had been around going from office to office for a couple years, to my understanding, trying to get started with some dentures, getting something done. And I felt so good working on this case because I don't know, there's just some cases that you're like, man, you really helped a person who literally otherwise would not have been able to get anything done. Once you hear the story of like, okay, I've gone to this office, that office, and nobody could accommodate me. And then just the feeling and the relationship that's built after that, amazing feeling. It's kind of like that's the thing that like when you're interviewing and you're talking about you want to help people, these are the situations that you kind of look forward to. So I did have to do all of his dentistry standing up, which is fine. And he was always in his chair. It was fine because it was like one patient out of, I don't know, however many that I get to see on a regular basis. Not that big a deal. So I was able to have his teeth extracted by the oral surgeon. Because of his medical history, I do extract teeth, but because of his health history, it was just of concern. And so I felt like he would be better off in the hands of an oral surgeon who could kind of really, take their time, handle everything, do all of the treatment, extract everything at one time. Whereas if I would have done it, we would have had to do, maybe one here, one there. And then that interferes with the healing. I wanted all of the healing to take place at one time. I wanted all of the tissues to be reapproximated all together, as opposed to taking one tooth here, taking one tooth there, just because he's unable to, withstand it being, in a general dentist office. So those are some of the decisions that you, as the leader of the practice, as a dentist, that you have to make, unfortunately. And fortunately, and then this case over here that required some special attention, I'll tell you guys about this. This is pretty good. So this is a patient that I inherited when I first joined the practice. And um, I was surprised by the amount of demineralization. So basically, if you look around the brackets, you'll see white spots. Those are white spots, and that's all decay. It was soft underneath there. When I touched it with my perio probe, it was all soft. So what had happened was the patient had been in brackets. They had not been evaluated by a general dentist in I don't know how long. They had not kept up with their oral hygiene regimen. They had not They just hadn't done what they should have been doing from an oral hygiene and dental visit perspective to keep those braces on. So these braces eventually came off by my recommendation. Again, as the general dentist, you are the quarterback of the treatment, and it's really important that you know that ahead of time. So I ended up writing a letter to the orthodontist who was treating the patient, and I requested for the braces to come off because I'm like, we would much rather him have teeth in order instead of him losing these teeth and then I have to go in and figure something out because he's not able to brush and floss properly. So, or he's just not brushing and flossing on a regular basis. So the orthodontist agreed. He took the braces off. We got the mouth in a healthy condition. And then eventually he got the braces put back on and finished the treatment. He was at the end of the ortho, but I was so concerned that this was just rapidly progressing, and I didn't realize, and because I inherited the case, I did not know how long this had been the situation. And one thing that I require for patients who come in for hygiene visits that are in ortho, I require for them to have their wires off so that when we take exams, take X-rays, I can actually see between the teeth. If the wires are there, it completely blocks the contacts, meaning how the teeth are touching. And if there's anything happening in between the teeth, I'm not able to see it because there's a white wire running through the X-ray. All my dental people, you guys know exactly what I'm talking about. So I encourage you guys to do the same. And I get it; it's an inconvenience for the patient. But think about had I not had these wires taken off, I wouldn't have. I mean, I would have seen it with my naked eye, but I wouldn't have been able to radiograph that and diagnose like what his needs were confidently. And I like to be very accurate, and I like to diagnose in like a very straightforward, accurate way. So removing the wires for me, it was just like, hey, we need to do it. And then the brackets needed to come off so that we can get him all remineralized and get some composites, unfortunately, done, get the hygiene under control, and then go back into the braces once we know that, we've done our part for him. Okay. All right. So here's another case. So this was interesting. I ended up losing the patient, meaning like he moved away. So I didn't get to finish all of the treatment. I was so sad because this was just amazing. So case selection. I had this patient who was 27 years old. They had a history of smoking and drug abuse. And in this case, you can clearly see that he used to use meth. He, according to his report, missing some teeth, but the occlusal surfaces or the biting surfaces of the teeth, they don't look that bad, which is great. So in this case, this was what I was going to do a caries control. I only started in one quadrant, meaning just one side of the mouth before the patient ended up moving away. But basically, in this type of situation, there's so much to be considered. And the reason why I wanted to show you guys this is because I want to display the complexity of a dental case. So you may look at this and you may automatically say, oh my gosh, he needs a bunch of fillings, or he may need to have the tooth extracted in the front, or he may need some root canals, which all of that is true. But my mind also starts thinking, I'm like, all right, look at the malocclusion, meaning like when he bites together, his teeth aren't occluding in the right way. So if I go and I start putting crowns and bridges and implants in this scenario, what's that going to do? How long is that going to last? How is he going to be able to keep it all clean? So if the teeth are straighter, we can keep them cleaner if he's motivated. So that I also had to talk about some of his habits and some of his motivations. If he's really ready to start taking care of his teeth, or is this just going to be a one concerted effort on my part, and then I'm putting all of my heart and soul into a case and the patient's not really committed to it themselves. Like these are all conversations that have to be had about, okay, are you going to stop smoking? Are you going to start brushing twice a day, coming to your dental hygiene visits at the recommended intervals? Are you going to invest in the toothbrush, invest in the toothpaste? Are you going to be okay with getting these teeth remineralized with some Fluoridex overnight? Like the areas of demineralization that can be remineralized in addition to all of the treatment that's recommended. are you willing to do this? And then are you gonna, participate and take your health into your hands and partner with me? Because if not, then the most ideal treatment plan, which would be just like off the top of my head, was going under ortho after we get these caries taken care of and the teeth that are not in that are no longer restorable, get those taken out of the mouth, get the hygiene under control. Is the bone levels even, are they even sufficient for the patient to go through ortho? What can we do about replacing this tooth in the front? Do we want to do an implant? Or in the interim, while we're thinking about an implant, do we want to do a flipper there or some type of partial? Like there's so many things that come into consideration with a case like this. But then I wanted to stop and pause and say, what do you want to do? What are you going to commit to? Because we can work this entire case up and get ourselves in a tizzy about, oh, this is exciting dentistry, and then you stop showing up for your visits, and then we have a half of a mouth complete. Like, unfortunately, like, I lost him, he ended up moving away. But I brought this case up because I really wanted to display the complexity of thinking, and how critical you have to think when you're diagnosing and treatment planning these cases. Like, it's not as quick as, oh, I know I'm just going to do a filling here, boom, 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 I'm going to extract this tooth there. No, you kind of have to work this whole thing up. So taking a diagnostic set of models to see, all right, how do the teeth occlude, mounting those models, what teeth do we need to keep, what teeth do we need to get rid of, and honestly, having a great, thorough, slow exam on this type of case is going to be your best friend. Not rushing. I wouldn't have rushed through this type of case at all. And in any other circumstance, like when you're out in practice, accuracy, you want to do it, do the treatment. You kind of want to slow down in order to speed up. That's my thing. I like to slow down in order to speed up, because you can kind of get ahead of yourself and then get yourself in a pickle. So, here's some stuff that I'm doing now as I begin to wrap up. Let me watch my time. Oh, 107, great. So I'm heavily involved in organized dentistry at all levels. At local level, I'm on the board here in Orlando. I'm the editor of the Dental Society of Greater Orlando. I am the new dentist representative for the state of Florida. And new dentist is defined as anybody who's been practicing 10 years or less. So I am working with a group of my colleagues at both the state and national level, in really bridging the gap for new dentists coming out of dental school for the state of Florida. I'm 17th district representative. I teach classes online. I am all over social media. Well, really just Instagram right now, because I don't really have much bandwidth for anything more. I have a single and a group mentorship program that I love. And I'm just continuing to make digital resources for current students, pre-dental students. I'm doing these type of events, where I'm just trying to give back to you guys as much as possible. And I think with my role as the new dentist representative, it's really good for, it kind of supports all of the things that I'm doing. And, all the things that I've been doing kind of also supports and points back to that, because I really just feel like there's just this world of dentistry that as a new dentist, you don't even know is available to you. So I'm working heavily with the ADA and just trying to bring more resources to students and to new docs, just so that you're not alone. You're not out here floating by yourself and only confined to the 90 people that you were in a dental class with. Does that make sense? So I think these are my socials. I'm at the Daily Dentist on Instagram, and I am the Daily Dentist at gmail.com. I always respond to emails. Sometimes it may take me a minute, but I like to be very intentional about my response, make sure that I give you an in-depth response. But I am available, and I just want to say thank you guys for having me. I didn't go over time. I don't think I did. Okay, good. So at this point, I'll mute myself so that you guys can ask questions.
Thank you, Dr. Wright, so much for that amazing presentation. We really, really appreciate it. We do have some questions, a couple from our Instagram and YouTube, so I'll just get started. So the first question is, you had mentioned how important or beneficial it can be to have a mentor. So what are some tips to coming out of dental school? If you don't really have any connections, what would be some tips?
Oh, Joining your local dental society. That's number one. Joining your local dental society. The dues may be expensive, but they do discount them for new graduates. However, that is the number one way to get a mentor, for one. And I know that, everybody is like on social media and everybody's like, oh my gosh, I want to talk to this person, this person, this person. Just make sure that you fact check, do your research on the people that you're connecting with, because you don't want to be led astray, or you don't want like your treatment sequence or whatever it is to just be like changed or thwarted based off of just some random person that you met. Like
Mhm.
even me, you know what I mean? Like I'm a
Mhm.
random person to you guys, but just do your research, have conversation, talk about openly what it is that you're looking for in a mentor. And so, for instance, when you go to your local dental society, there may be some type of new member or new dentist something. Whoever is like the chair of that, ask them, oh, do you know if there's anybody that I could connect with in this particular area? And then when you reach out to that person, tell that person, hey, this is what I'm looking for. And then you will be surprised the opportunities that are available. They may say, well, I don't have anything, or I'm not able to be your mentor, but I know so and so, Dr. So and so, my buddy over here, he is doing this or she is doing that. And it would be great for you to meet them. And hey, I'll introduce you guys. I think that's the number one way.
Mhm. Awesome. Thank you. Our
You're
next
welcome.
question our next question has to do with just kind of the idea of like corporate office. So
Mhm.
you're definitely the general dentist there, but are there other like specialists at that office too, or how would that dynamic work?
Oh, I love that question. So at my office, no one comes into my office, and in none of the offices that I've worked at. So I've only been with one company since I graduated. I've moved around a bit because, like, my offices have done pretty well because I'm very systematic in my thinking. And sometimes, some offices don't have that. So, there are some offices, like with our company, there's some offices that have a specialist that's at that particular office. So if there's somebody that I need to see that needs to see the specialist, I'll send them to the next office over that I know the specialist will be at. So the specialist will come and travel from they have like a home base of like maybe
Hmm.
Mondays and Tuesdays, they're in this part of Orlando, Wednesdays and Thursdays, they're there, and maybe they don't work on Fridays, or maybe they do a half day at
Hmm.
Fridays at so and so's office. And so I'll say, hey, these are your three options. You'll go to one of those. You know what I mean?
Hmm. Hmm.
And then, and there's even sometimes where they're like, well, what if I don't want to see your specialist? And I'm just like, oh, great, because I have some people who I think that you can see as well within the community. So that's one way of doing it. Some DSOs do it where the specialist is in all of the offices and they
Hmm.
come on a certain day. I don't really know how that works, but we only have just like certain specialty. And then I have people that I refer to that I'm just like, all right, I know them personally. I know that they have the same treatment ideas, treatment sequences that I have, et cetera, et cetera. Make sense?
Yes, absolutely. Thank you.
Good.
Uh,
Yeah.
so the next question is like to you, like would in the future would you
Uh-huh.
ever think about opening a private practice? And if so, what are some
Oh, yeah.
things you might have to like get ready for? Like what would be like a plan to do that, if that makes sense?
Oh, yeah, for sure. So the answer to that is yes. And my
Hmm.
husband and I, we've been in this process like
Hmm.
already. We just
Okay.
have not found the ideal location. So the
Hmm.
first things first that you need to decide upon, in my opinion, is you need to decide if you want to do a practice acquisition or a startup. Startup is like from ground up, you're going to be recruiting the patients, like you're going to be doing all of the marketing, all of the everything from start to finish. Like there was no blueprint, no nothing, nobody before you to kind of pass that torch to you. Whereas the practice acquisition is, okay, Dr. So and so is 65 and ready to retire. They are looking for an associate to come in, or they're already have their practice up for sale. So first things first is you need to decide on which route do you want to go. There's pros and cons to both. I mean, the main one is that there's already an established patient base, with the acquisition, the materials, the chairs, the everything that you need. You basically kind of walk in and you have a practice, you know what I mean? But of course, you have to spend some time getting to know the patients for like a year or two before the transition. You have to do some treatment on them. If they love it, then you continue. It's like a kind of holding the hand, baby stages, honeymooning for 2 years before you completely take over. And then you have to think about money, like how much debt is it going to cost you? Like if you have to do any renovations, if it's going to be a startup, that's going to be a lot of debt, a lot of loan money that you'll take out to get that practice started. So that's another thing. And then working with a broker, that's another aspect of this, like making sure that you have like a broker who you're working with. Or someone like a lender. Sometimes I've heard people say two different things. They're like, oh, don't work with brokers, or these are the only brokerage companies that I work with, or you don't need a broker, just work with like the bank and do all of this stuff yourself. But then that puts more of the brunt work on you. So it really just depends on like what your personality is, how involved, how, hands on, hands off you want to be, but those are three aspects of starting the practice. Oh, and location. Where do you want to be? And while we're talking about location, if you work for a corporate office or even a private practice, let's say you do that first, there's something in the contract called a restrictive covenant. And so you need to know that language because it's usually based off of how far, like a radius, a 5-mile, 10-mile radius of that practice, you cannot practice within for X amount of years after leaving that office. So my practice is very far from my house. It's 30 minutes away, like 45. I've always done it that way for a reason, because when it's time for me to open and buy, I want to be in the area that I live, because I don't want to be held captive by the restrictive covenant. So that's a little tip for you guys too.
Wow, I had no idea. That's actually very
That's okay.
interesting. Thank you. Yeah.
Yeah, no problem. That's what I'm here for.
Sarah, next question is from our Instagram. And someone asked, do you have any helpful advice for minority students when applying regarding competition competitiveness, and just things maybe regarding that?
Yeah. I'm going to do a shameless plug. So I have a guide, 4 mistakes to make and get in and thrive. You should look at those. And then, but I'm going to tell you what I'm going to tell you. So looking at those guides, and then also applying early, knowing your strengths, knowing who you are. So for one, that application, by the way, soft opening for this coming cycle is May 11th. The earliest you can submit is June 11th. I don't know if you guys know this, but I talk to my mentees about this like every month, where we have check-ins every week. And I'm like, don't forget the soft opening. My goal for all of my mentees is soft opening day. We're dragging and dropping, we're editing. We're not still getting ready. Like we've been getting ready for the past 8-10 months, so preparing in advance, knowing where you are in the application cycle, meaning, all right, so if it's the year before I want to apply, I need to start writing my personal statement now. I don't need to wait until the month before to start writing my personal statement, because that is going to hold you up and keep you from submitting. Like if you can have that application submitted early, it works like charm. I'm not going to say that's the thing that's going to get you in, but I feel like that's the thing that will get you an interview, because by the time like the deadline comes and you're submitting like close to that deadline, the admissions committee has reviewed a bajillion applications by then. Like the class is pretty much already selected, and you're just now being thought of, and that may like eliminate you. So applying early, knowing your strengths and weaknesses as an applicant, it's really, really important. So knowing like, okay, if you're not the strongest at communicating your why, if you're not the strongest at talking about yourself, like in a non-arrogant, but in a confident way, you need to practice those things. If you can't articulate why you want to be a dentist, that's the first question that all dental schools ask at their interview. That's the one thing that you need to knock it out of the park right away. You know what I mean? Like if you don't have shadowing hours, if you don't have volunteering hours, you need to ask those things. And honestly, you need to advocate for yourself. So like if these schools offer like advising appointments, which the majority of them do, take the advising appointment. I would not have any fear of what they're going to say. I would totally put myself out there and say, all right, I need to hear it from the horse's mouth. What do I need to do? Or am I a good candidate right now? Instead, I notice so many students are just like, I don't want them to tell me anything negative. And it's just like, I would rather them tell you now than to reject you later, you know?
Yes,
That's just my
absolutely.
perspective, you
Mhm.
know? So,
Awesome. Okay, we have time for one more question. I don't want to hold you here
okay.
for too long,
Oh,
but just a question regarding like maybe with the interview process which you had just mentioned, what would be like some tips
uh-huh.
for somebody that's anxious? Because I know a lot of people have like just interview anxiety, and what would be some tips from you or like your own experience, perhaps?
Ooh. Oh, yeah. So for one, breathing, monitoring your breath. I know this sounds so crazy,
Mhm,
but whenever I'm anxious, and believe it or not, I get anxious in hostile situations with patients all the
mhm,
time. But
mhm,
I just take a breath, and then that really starts to relax me. So monitoring your breathing, number one. Number two, knowing that you already have the answers to the test when it comes down to the interview. Like, you are the subject matter, like you're the topic of discussion. And so, who knows you and your application better than you do because you put it in? You know what I mean? Knowing your application back to front to back. There's no question that can throw you off because you are the topic. Like, that's the one thing that if I could like just open up your brain and like put it in there, just reminding you that you are the topic. So you have literally all the answers that they could possibly ask you. Just knowing how to respond and not to get down on yourself, because the admissions committees, they really look for confidence, they look for humility at the same
mhm,
time. They look for you to just have knowledge of self, knowledge of the field. If you remember the interactions that you had when you were shadowing or when you were volunteering, and they look to see, does this person light up when they talk about dentistry? Like, if you're allowing your anxiety to lead you, they won't get to see the passion that you really actually have. You know what I mean? And then that may be the thing that eliminates you. So just
mhm.
remembering that you're the topic, that you have all the answers, you can't go wrong with that, you know?
Oh, oh, that was amazing. Thank you. That personally makes me feel
Yeah.
so much better. Thank you so much.
Yeah. Yes. You can
Um,
do this, guys.
oh, thank you, thank you. That's just so motivational. Thank you again.
Yeah,
Um,
you got it.
okay, so thank you everyone for watching. And once again, thank you
Thank you,
so much
guys.
to Dr. Wright for coming on our YouTube channel. That is it for today. And tune in next time. Bye,
Yeah.
everyone.
Bye, guys.
Bye, Dr. Wright. Thank you so much once
Bye.
again.
No problem.